Thank you, Honorary President. Good morning, sir. Good morning, Brekete Family members.
Good morning, Doctor.
I want to thank our Honorary President once more for the opportunity to come here and to talk to members of the family. It's a very large family, several tens of millions of people all around the world. And I don't take this for granted. I should thank you always for the opportunity to share my knowledge with the entire world. Thank you so much. I'm grateful for this. Today, Honorary President, I will talk about something that affects everybody, but mainly the elderly. Yes, but anything that affects the senior citizens, one way or the other, also affects everybody. Because in Africa particularly, we bear the burdens of our fathers and our grandfathers. Yes, so I'm talking about insufficiency fracture. Insufficiency fracture, it means fracture that occur in a weak bone that's resulting from very minor force. Ordinarily, the way God made our skeleton, it's supposed to be tough, and we are supposed to be able to resist, some forces. Like we fall, we get up, and we keep going. Even minor accident, we just, dust our bodies and we go. But there are some conditions in the body that occur that we take for granted, but normally when we are healthy. But when those conditions of the bone occur or exist, they can result in very severe injuries. Okay, like in situations in which patients have osteoporosis. Osteoporosis is softness of the bone. And this,
I say I don't suffer.
Honorary President, you are not suffering it. The way I see you walking around like this.
Okay, make her walk again. Make her walk again. So it shows signs say my bone done the week. No be you be doctor. Say the highest doctor for among they be na animal doctor, and he specialized for goatology.
Honorary President.
Sorry for interrupting you, sir.
Thank you. That your walking step is you in 50 years' time. Okay. So, some people maybe from above the age of 60 or thereabout, when they have this weakness of the bone, just falling from the bed to the ground can result in a fracture. Or maybe you fell on your hand, just to use your hand to support your body. We can have fractures in the wrist. So, and it has far-reaching implication in terms of even survival. That's why we're talking about this today. 5% of men and 20% of... No, I would ask for it. Okay. Okay. Okay, so that's the wrist fracture. It's called a Achilles fracture. The fracture of the distal radius is very common in patients that have weak bones. Just to fall a little on the hand, they find that they have a fracture. So 5% of men and 20% of women above the age of 60 have osteoporosis. And 50% of women generally will have fracture in their lifetime above the age of 60. Yeah, because of the softness of the bone. There's something peculiar about women. especially the postmenopausal women that have stopped menstruating. You know, estrogen that is produced, that's the women hormone. The hormone that what makes women look beautiful, look, you know, nice, and their skin is glowing and their shape. What makes them look like that is estrogen. Is a hormone that is produced by the ovaries. Yes, and that's what's also responsible for the monthly cycle. But around menopause, that hormone drops drastically to almost zero. And then they stop menstruating. The moment they stop menstruating, their bone strength drops drastically. Yes, and women that have reached menopause, they are more prone to fractures. So little injuries, little force, they come down with a fracture because there's a sharp decline in the strength of the bone, because that hormone helps to confer strength to the bone. But once the hormone stops, the strength of the bone reduces drastically. So in almost about half of women in their lifetime, above 60 would have one form of fracture or the other. It doesn't have to be very severe fracture. It might just be fracture of the small bones of the hand. It might be fracture of the toes. But the major fractures that concerns us are like the hip fractures, like the one that is on the screen now. Fracture of the hip. That's a very dangerous fracture. You find elderly people, they just miss their step at home and they fell on the ground.
Yes.
Normally, every other person will get up and move on, but they can't move on because they have sustained a fracture because the bone was weak. And that can land them in the hospital. And if care is not taken, that can actually be the end of their lives. Because 30% of elderly people that have fracture of the hip would die in 1 year. Yes, even in the best of centers, because there are complications like blood clots in the body, like bed sores, even infection, pneumonia, so many complications. So the best bet is to prevent that fracture from happening. So let's talk about I've talked about some of the causes, osteoporosis, but like vitamin D deficiency in people who are not elderly. Vitamin D deficiency can be a cause of weakness of the bone. Because
I get that.
Ordinary President,
continue.
You don't have it. Okay, so vitamin D helps to push calcium into the bone. And calcium is what makes the bone strong. So the bone is like a pillar or a concrete. So the concrete is made up of cement, is made up of rod, and is made up of stones.
And sand.
So all those ones are what make a pillar. So in the bone, calcium is like the cement of the bone. Yes, if the cement is very limited in quantity, you know that concrete will not be strong.
Yes, sir.
Yes, so the body absorbs calcium from the intestine and sends it to the bone to strengthen the bone. But if for any reason the body is not able to absorb calcium, the bone will be weak. And the vitamin that helps the body to absorb the calcium is vitamin D.
D what?
Vitamin D, generally.
We have D3, D2.
Yes, there are different types, but let's just classify all as vitamin D. Because the D3, D1, D2, they are different stages of the same chemical. Yes. So, but vitamin D3 is the active form of vitamin D. So it acts in the intestine to help to absorb the calcium that we eat and send it to the bone. So if, for instance, maybe due to excessive alcohol intake or some disease, one is not able to absorb the calcium or the vitamin D is lacking, then the bone will be weak. So, and that can result in fracture. So these are some of the common things that can result in weak bone. In general population, it doesn't have to be in the elderly. Lack of vitamin D can cause it, or some absorption problem. But in the elderly, in the senior people, postmenopausal women who have no estrogen to protect the bone, it can lead to weakness of the bone. And then, of course, generally, as the older we get, the softer our bones become. So all those things, they predispose to insufficiency fracture. So how do you diagnose the fracture from history? Many people don't even know that they sustained a fracture. Yes. A very simple, innocent injury. But the woman has realized, I've been having pain in my hand. I've been having this pain and it's disturbing me. Maybe after the incident, she continued with her life, but she does realize that there's this pain that has always been there, you know. So maybe they go to traditional people, they stretch the hand, you know, until maybe after 1 month or so, someone tells, just go to the hospital. And they come to the hospital, we do x-ray, and in the wrist, we discover that there's a fracture, or in the leg. But there are some that you cannot postpone, you can't hide it, because it involves the major bones, either the hip or the spine, or even the pelvic bones. Hip fracture would keep that person on the spot. If you fractured your hip as an elderly person, you can't even get up from that place. Yes, you just, maybe someone went to the toilet. It's very common. An elderly man in his 60s or 70s, or a woman postmenopausal.
Yeah, grandma, stand up.
Yes, went to the toilet, and then he slipped. Maybe there's a wet floor.
Yes, sir.
He just slipped and fell on the ground. She remains there. For people who live alone, many of them, they find their dead bodies there after some weeks. Yes, especially abroad. Especially people who live abroad, because they can't move from where they are. They haven't sustained a hip fracture. Yes, but if there is help, they quickly rally around them and take them to the hospital. Like, for instance, the fracture of the spine. The spine is one of the areas that manifests softness of the bone a lot, because the spine is made up of small bones called the vertebrae that are connected to each other to form a column. Now, those bones can get so soft that even to enter a gallop or a pothole, and the vehicle takes you up and down, that bouncing movement can fracture the spine.
Yeah. In
a patient that has weak bones. Yes. So, and then the person comes back from travel and say, I'm having this back pain. I'm having back pain. Complaining of the back pain is severe, goes to chemist, takes something, it's still nagging. When they come, we do x-ray or we do MRI, and then, of course, the fracture is looking at us there. So it can be that serious. And, of course, there are some other fractures anywhere else. So when we take history, we can already know where the problem is. Most of the time, there's a history of fall. But many times, the people have forgotten what happened, but the pain is what is pointing them that there's a problem. And then with the x-ray, we're able to diagnose. And then we also do some other investigations, like the MRI I talked about. We can also check for vitamin D level in the blood when we are trying to find out why is the bone soft.
So you get tests where they fit do to check the quantity of vitamin D where they for person blood.
Yes.
If deficiency they una go fit augment them.
Yes, we do vitamin D assay to check the level of vitamin D, and usually vitamin D and calcium level, they go the same direction. If vitamin D level is low, the calcium level will be low. The reason why the bone will be weak is that the calcium in the bone is a reservoir of calcium. Even though it's playing a very important role in the bone, but calcium play more important role in the body than in the bone. Yes, it's needed for the heart to contract. It's needed in other muscles. It's needed for even the nerves to work.
It's just like
so if the blood level is low, the body will borrow from the bone to do other more important function in the body, and then the bone is perpetually weak. So you have to now give the body sufficient quantity to be able to do the other things and still save the rest in the bone to have more strength in the bone.
So you just like water tank for house. If you put them above the house, the pressure go there.
Yes.
If you can't put them for ground, you know can't get pumping machine where go pump and where baby the vitamin D
Yes.
where go pump the calcium into the body of the tank.
Yes.
My example makes sense.
Perfect.
Thank you.
Perfect.
Open a clap for me small.
So the treatment, when we diagnose the fracture, it depends on the type of fracture. Some are very simple, innocent fracture, either fracture of one of the small bones of the hands or maybe of the legs. Those ones, we can just do simple strapping or casting. Colles fracture, which is the fracture of the wrist, that one we will reduce it and pull it to make sure that it's in line, then put a cast for 6 weeks. That will suffice.
6 weeks.
Yes. After 6 weeks, the fracture is supposed to heal. Yes. But for more serious fractures, like fracture of the hip, that one will require internal fixation, to require a big surgery to fix the fracture. And the earlier, the better. Because if that man or that woman who is elderly is lying on the bed for upward of 4 weeks without coming, because I find some people come late when they don't come in to fix the fracture early so that they can quickly get up and start moving. Blood clots, it's not the fracture that will kill them. Blood clot in the vessels. Because when an elderly person is lying down in one place, blood will begin to form in the blood vessels, the clots. And that clot can get to the heart or the lungs. And once it blocks the vessels, that's the end. So is that complication that we even fear more than the fracture. So that's why even after surgery for elderly people, we want to jack them up, start moving as early as possible. And they will also give blood thinners, some medication to thin the blood so that the blood will not clot.
So we will get elderly parents when are they here now? We will get elderly parents when are they here now? We they here now? Make we do the needful. So you know good make elderly people sit down for one place for too long.
Yes.
Lie down for one place for too long.
Yes. It's very dangerous.
Oh. Yes. Yeah.
So even for the same spine, if the spine is fractured, there are also special surgeries that we do for them. So, like I said before, the prognosis means what's the outcome. Like for hip fractures, like I said before, about 30% of people 60 years and above who sustain fracture of the hip will be dead by 1 year. And that's what the statistics shows.
1 year.
Yes, before the first year anniversary of that hip fracture, they are dead. It's not. I mean, I'm not even talking of people that are neglected. I'm talking of statistics in advanced countries.
People will get care, and love.
Yes, because there are many reasons why they die. It can just be pulmonary embolism. They are just this. Oh, daddy had a fracture 3 months ago, and then suddenly started having difficulty in breathing, and the rush. The heart has stopped. Is gone. Is the fracture that predisposed him to that pulmonary embolism. Pulmonary embolism is blood that clotted in the vessel has now gone to the lungs and blocked the vessels there. So the man dies and goes. Pneumonia, because they are lying down in one place, they are not moving around, no enough circulation of blood, air and all that, the chest infection sets in. And then before you know it, he's not able to breathe well, he dies, he just stops breathing. So then some of them, they have bed sores. Because they are lying down in one place, their muscles are weak, they can't turn around. That bed sore can become infected, and before you know it, it can just lead to death. So there are many pathways through which that disease itself can kill, people who are in the elderly category. That's why we like to quickly take action for the elderly when they have sustained a fracture. Yeah.
What can young people do people that are maybe in their 30s, 40s, 50s do to prevent this?
Honorable President, you are a genius. I'm coming to that.
When I don't hear now. From today, my name na Julius. No be what you call me. Doctor, what do you call me?
Genius.
Oh, I think na Julius.
So, because that is a big part of the lecture today. In fact, if anybody did not hear anything, it is this prevention. Once you take the prevention, you have taken something home. So how do we prevent this insufficiency fracture? How do we ensure that we don't fall victim of weakness of the bone in our later years? First and most important is exercise. Exercise helps in doing two things. One, exercise, especially resistance exercise, they help in strengthening our muscles, and they also help in strengthening our bones. The reason why people fall when they get old, in fact, the reason why people don't survive too long into old age many times is because of weak muscles. And exercise helps to strengthen the muscles. Because if your muscles are weak, they can't carry you. That means that you are going to soon be confined to a wheelchair or to the bed. And then once that confinement has happened, the time is not too much anymore, because everything will just be falling apart, like I explained earlier. So exercising the muscles help to keep the muscles strong, and it also helps to keep the bone strong. And that means you are preparing well into your old age. And that's why you see life expectancy in Nigeria is 54 years. And that's, if someone is born today, what is the average age they will live is 54 years. But in a place like, let's say United States, about 77 years. Even in Morocco, North Africa, is 70 years. So that means they live longer than us. And one of the things that makes the difference is exercise. They have very good exercise habits over there. But we don't like to exercise. And I can't emphasize it enough. This morning, I've already gone on my treadmill before coming here. Yes.
You're going to clap for doctor.
I exercise. I do like 45 minutes to 1 hour exercise every morning.
I get one treadmill for decoration. No, sorry. Sorry.
Yeah, some people have it for decoration. It's like having a book in your library and you have not read it. It's of no use. So we must exercise. And see, our bone. Can I start that graph on bone strength? Our bone strength becomes maximum at the age. No, not this.
Backward. Go back.
Graph. It's a graph. Yes. Okay, so now this is the graph of our bone strength versus our age. Bone strength is on the straight axis, the horizontal axis. The vertical axis, sorry. Why the age is on the horizontal axis. You can see that it's rising, and then around the age of 30, that's the peak of the bone strength. Then it starts going down. But from the age of menopause for women, you can see a sharp decline of the bone strength towards that arrow. So our bone strength can be maximized at 30 years of age. Anything from 30, the bone strength starts going down. So if those of us who are not yet 30, you still have the opportunity to strengthen your bone.
Like us here, but
okay. To strengthen your bone until you get to 30. Because after 30, the bone strength will start going down. But for women, after menopause, there's a sharp decline in the bone strength. So resistance exercise, the right diet and all that, they help us to maintain a good.
What if a woman was able to develop the habit of doing this exercise from her 20s, 30s, 40s till she entered menopause? Is her own decline going to be as drastic as that of the other woman that never engaged herself in exercises?
Okay, so what will happen to that woman that was already doing exercise.
Yes, sir.
Is that the starting point of her decline will be higher than the other woman. Yes. So after what has been left, she will still have something sufficient to keep her going. Yeah, that's why it's good to hit peak of bone strength before 30.
No wonder Pamela, they go gym.
So that by the time you start declining, your reserve level is still high. Yes, so that's the reason for, and there's one good news for people who are on the big side. People always say they want slim people, but those who have weight, especially women that have weight, they have stronger and bigger bones than those who are slim.
I like big women.
Yes, so those ones are relatively protected from this insufficiency fracture compared to their slim counterpart. Yes, so that's one advantage of being on the big side.
So Orobona get advantage.
Yes. So another thing is vitamin D supplements. Yes, it's good to, if you are not having enough dietary supply of vitamin D. What are the dietary supplies? The number one source of vitamin D is fish, salmon fish. Salmon is
Dr. Otabor.
But even if you don't have mackerel, mackerel contains a lot of vitamin D.
Allow him.
Yes.
Now, even to soak gari a problem for this country. Now, Dr. Otabor, they shout mackerel. Solomon and mackerel.
Mackerel is Titus. Okay. Okay, so both of them, mackerel and Titus. Everything is expensive. If good food is expensive, try illness. Yes.
That is true.
Which one is more expensive? So you have to rationalize. Yes.
Sickness is more expensive.
Exactly. so vitamin D supplement.
One Solomon, one macron.
Salmon, mackerel, Titus. Salmon. Yes, those oily fish, they contain a lot of vitamin D.
What of catfish?
Well, I don't know about catfish. It didn't come up strong as among the list.
Yes, sir. Okay,
yes, so I can do research on that, but I don't know about
it. Wait. When I hear waiting Dr. Otabor talk, he is not claiming to be all-knowing. He said he go do research. Can't make we appreciate this man. Now I make your enemies no go ever succeed where you did. In fact, one don't lose her job now. They don't sack DG Napti. We get some directors now, about 3 directors for that Napti. We don't turn Napti to their father house. Who we go give their names? They go transfer them to Ministry of Local Government. And here, continue.
Okay, so and then supplements of vitamin D, especially for women who have reached menopause or crossed, and for elderly people, vitamin D supplements, calcium supplements, they are also useful. Then it's also good to check our eyesight. When you are getting old, you must go to check your eyesight at least once in a year with the eye doctor, because sometimes it might just be a misstep. You want to, you are trying to come down the steps. You didn't see that one step is still there, and you just missed it, and then on the ground. That can result in something big, and it can cost life. So it's good for elderly people to check their eyesight to be sure that their sights are okay. Otherwise, it can lead to unnecessary fall that can now become something, really big concerning their health. Then avoid slippery surface in the house.
Like slippery tiles.
Yes, I know that marble is good, it's nice, those beautiful tiles. But at certain age, you must go for the tiles that has good grip on your feet, not the slippery one. Yes.
You know, say that time where you did talk.
Yes.
You know the next thing will come my mind. My mother. In fact, this today, we they go change the tiles of our house. All of them no go there slippery. You get the type. You only say if they more expensive than the slippery shiny tile.
Yes.
They go change them more.
Yes.
If there no fee break and come out, they go put them on top of that one. Simple.
Yes. Then even the footwear that we wear, at certain age, you are not going to be too concerned about being trendy. Rather, you should be concerned about your safety. You say you get footwears that will give you stability on the ground, not something that is too high or, that can easily sway you to fall. So that's also very important. And lastly, if we can avoid smoking, stop smoking, because smoking reduces the strength of the bone. And then if we can avoid alcohol, let us avoid alcohol, because alcohol helps to it blocks the absorption of calcium from the intestine into the bone. So these are just a few things about insufficiency fracture.
Well, I know we appreciate now. Will you ask question?
Yes, please. Either on this one or any other thing.
Yusuf Umar, he said, my ordinary president, may you live long. That Malama is going through a lot. We held a meeting in the Islamia, and she says she wants to close the school. She not go close that school. Amen. By the grace of God, she not go close. Amen. It go be, she go get that physical school, and she go get online Islamia. I never see online Islamia before. But inshallah Rabbi Ta'ala, this Malama will be the first person to have an online Islamia on YouTube, Facebook, Instagram, TikTok, and the rest, by the grace of God.
Amen.
We're going to set a standard curriculum for her, and then maybe we will talk the time where the Islamia go come live. Apart from her pre-recorded, sessions where she don't do, this one go be live. She go get students from where go connect live. Waiting, they can't frustrate her. No, not even this frustrated person will come up from Jos, where we hear say now pursue they pursuing Papa self. I just miss Barrister Adams' call. Yes, anybody get question for studio? Take the microphone round.
Daddy Politic.
Yeah?
I have one question.
Not be you go start. Because you near me, you know me straight, now you go start. Yes, madam.
Thank you, doctor. Good morning, ordinary president. My question goes like this. My auntie is suffering all these things that you are teaching since, but she always say maybe she match poison. I will advise her to go to X-ray to check whether it's poison or anything. Say we should go and pray for her so that maybe somebody is after her life. So when they are teaching is because
as this is talk, it be like say it mirror everything.
Honestly, because this is my first time of hearing that all these things can happen to somebody that after menopause. Because I always go to exercise with my children. At times I'll be feeling ashamed because since I enter menopause, I always follow them to exercise. But then when I talk to them, they will say maybe they match poison or anything. So what am I going to tell her now? Is it to go for X-ray or anything? Because I'll be asking her to go and buy biscuit bone for calcium because I don't know what else to say. I don't ever believe in poison or anything.
Let's appreciate Dr. Biscuit Bone. Thank you, ma.
Thank you very much.
Dr. Otabor,
yes,
you don't hear from Dr. Biscuit Bone
for calcium.
Thank you for your question. Very interesting. See, you are not alone in this. Even when patients come to meet me as a specialist, they are telling me that they match poison. I don't know how they expect me to believe that. But that's actually what has
many
already...
people
That is their mindset.
In their match.
Yes, that's their mindset. Until we're able to diagnose and solve the problem, then the poison would have left their system. So the advice for your sister, tell her to go and see a specialist. Let her go and see the doctor. Even if she still believes she matched poison, the doctor will remove the poison. Thank you.
Okay. Warrior Elder won't talk. Before you go, allow Pamela talk small.
Okay, thank you, Dr. Otabor, one more time. My question is, person will not get money for treadmill or all those gym equipment. What kind of exercises should they engage in, particularly the elderly people?
Okay, very good. Thank you for that. These are our two legs that God gave us. It can help us to run our way into health. Running. And it doesn't even have to, you don't have to go to the field. If you have a big compound, you can run around your compound. 30 minutes, 2 times a week will do a lot. Apart from running, for the younger ones, you can do push-ups. Yes. And the other aerobics that you can do, it doesn't have to be treadmill. Yes. So brisk walking, running, they are the best exercise. Then swimming too, if you have the means to go to...
Some people na stone. You drop them, they go...
you can swim in shallow swimming pool. Yes. Maybe like twice a week. So, but the best one for you is running. You run around the house like several times a day. You are sweating. Anything that can, increase your respiration and your heart rate.
That English way you talk, increase your respiration. Breathing. Anything will go make you breathe well.
Yes.
Now the breathing, make I give an example. Una see tire motor tire, tire motor tire. If they park tire motor tire for one place, they no drive them for a very long time. Waiting they happen to her.
They flex.
The tire they increase, it they go down. If you allow them for too long as he go down, so when you one pump, it don't crack.
Yes.
It no get the elasticity. It no get the chewing gum we go make her come back again. The next thing we are now, woman being hard based on research what I do. If you they run, they do other things. If they pump, pass like blombolo, you go, you come back, you go, you come back. Anytime where shock happen to you, you go feel whole. Anytime where it be like say you there for bad condition, because your heart they get that exercise, it go fit withstand them. I don't know what they are.
Perfectly correct, sir.
Call me that name again.
Genius.
Julius.
Genius.
Yes, Barrister Pamela.
Yes, Doctor.
Sorry, sir. No, okay. Over to you.
Okay, sir. Doctor, my question is on arthritis. Arthritis is on the knee, right?
You are talking up the mic.
The arthritis is on the knee, right? So does
on the knee?
Knee.
Yes, arthritis can affect any joint.
Okay.
Mostly the weight-bearing joints.
Exactly. So the one for the knee, does it have a long life impact, like when you've lost weight?
No.
Okay, sir.
Just there. Make una no vex. Now my PA. For those of una way be enemies of progress. Una no go tell my wife now. We see ordinary the romance.
Thank you, sir.
For TV, so then the romance. She hold her, you hold her.
So, does it have a lifelong impact after you must have lost weight?
Yes, weight loss has been proven to improve on the symptoms of arthritis of the knee, especially in women. Yes, because what happens is that when the knee joint is loaded with excess weight beyond its tensile strength, it begins to crack. So, and that's what leads to the different other things that happen in the knee joint that we call arthritis. But studies have shown that if women lose weight significantly, the pain associated with arthritis also reduces.
Okay.
Yes.
But is there any remedy?
But it does not cure it.
Oh.
Arthritis is a continuous thing that end up damaging the joints, and the end point as at today is knee replacement surgery. But though other modalities of treatment are being tested now, like stem cell treatment to regenerate the cartilage.
I get them.
So the only remedy is to just keep losing weight and keep losing weight
and exercise.
Exercise
will help stabilize the joint. Weight loss will reduce the pressure on the joint. Yes.
Now, for those of us we get severe pains for our knees, not be every pain be arthritis, some na gout. Doctor, educate us between the difference between gout and arthritis.
I would like to propose that we will give Honorary President a diploma in medicine. Because you are just on point today. Okay.
My wife take care of me.
Yes, gout. Gout is when you have increase in the level of uric acid in the blood. Uric acid is one of the byproduct of protein metabolism. When protein is digested and is taken into the system, after it has done its work, one of the products that comes out from it is uric acid. So that uric acid is excreted through the kidneys. But if the quantity is too much, or the enzymes that helps to break it down is limited, we are going to have a lot of uric acid in the blood. And when it gets to a certain level, it will now concentrate in the joints. And it can cause inflammation. It can behave like arthritis, like what Ordinary President said. Yes, so we treat it. Usually we're able to differentiate it from X-ray features and also from the history. Yes, and when we do the uric acid, that's why sometimes when patient comes to us with pain in the joints, and then we are running tests, they say, doctor, just do X-ray. Now, why are you asking me to do blood test? We want to rule out other things that you may not be thinking about. And sometimes uric acid is high, and then we just know that it's gout you have. It may coexist with arthritis, but it might just be the only thing. Okay. Yes.
Now, additionally, Ingo explain, if uric acid too much for your body, if it affect your kidney. Doctor, educate us.
Perfectly correct. So excess.
Diploma in doctor. Diploma. Bachelor. How?
Thank you, sir. We don't get triple doctor. Now where you don't give a diploma in medicine, that one a doctor.
How will give me a suggestion?
This one where you don't suggest so, and the way you come they educate us, they on point. So how we come take call person we don't get for doctor?
Call me Julius.
Julius. Okay.
Come on, Dave.
Julius.
You get question now.
Bachelor.
Doctor, thank you very much for this enlightenment. The question I want to ask, we say, very oftentimes they tell us, wait.
Please, doctor, help us explain what uric acid fit do our kidney, because many people they suffer this kidney problem. If you go kidney center, I hear say Sahad don't open hospital. Yes, they say they get kidney machines and the rest. Nobody to go there. What you can do to prevent your kidney from getting damaged, doctor, I beg, help us. Yes. Uric acid, you hear them small like this. Eating they form like sansan, like gari, way sour for your joints. Yes, and the pain no be, you go start small. Before you know wetin dey happen, it don't they enter another thing. Now, if you come begin they affect your kidney go they weak, they go. As it they weak, they go. Danger.
You're right. The uric acid, when it gets to a certain concentration in the blood, it can begin to crystallize. You even see it as small crystals, like the way you see sugar. So it's there. It can deposit in different organs in the body, and in the kidney, it can affect kidney function. So if it's not treated on time, it can really affect the kidney. Yes.
Okay. Follow quickly on that. I will not vex. Doctor, waiting be uric acid.
Okay, so I told you before, I said it's the byproduct of metabolism of certain things that we eat. The commonest cause of, when we want to prevent uric acid from accumulating in the body, we tell people to avoid red meat. We also tell them to avoid wine. So only the enjoyment things.
Everything swear. I want chop swear. Red meat, one. Kilishi. Then wine.
Red wine.
Yes. Wine can cause a lot of uric acid to accumulate.
Haba! It be like saying I cause my own. Now your body have been on my body.
You know that, but you know they chop red meat now.
So, and my own at a point before I chop.
You know they chop.
When I notice I know they chop
red meat.
Even meat generally.
Fish too.
Now me then go serve me food. You know I go chop finish. I go forget say they put meat or fish for me. Sometimes I don't wash hand finish. Now I go to remember, say, I go call person, say, help me chop this.
Yes, sir.
See, make I tell you now, to eat food itself. I don't forget, say, I never chop. Sometimes now around 4 or 5, now if I swallow saliva, it be like, say, belly tummy, I go ask myself, what did I chop? Then I go call remember and say, since morning, I never chop. And me, I the day healthier and stronger when I never chop. Once I eat, I don't lazy. Now I make, sometimes if I come house, my wife no dey agree give me food.
Because you dey strong.
Yeah. Now after she don't give me work, when I finish the work, as a good boy, they go give me food. As I chop them, I go sleep go.
Honorary President, yes, we cannot use your own experience to generalize. You are a big man. You are a big man. So food is pursuing you. You are running from food.
When I hear,
but poor men, a big man.
Oh,
yes. But there are people who cannot afford that food to eat. So you are avoiding excess food, but we are talking about people who are lacking food, so that we are on two extremes. Yes, so we have to take that into consideration.
Thank you. Make una appreciate Julius, Dr. Otabor, aka Julius. Sorry.
You get this when don't they general like a notion when they call biscuit bone be brisket or brisket bone. Yeah. Now, most people, if they add anything to the bone, like vitamins to the bone, because sometimes they go say, we eat that brisket bone, we go help support the bone.
Okay, thank you. Before I forget this issue of uric acid, because Honorary President emphasized a lot on it.
Yes, sir.
It's one of the tests that we do when we are doing annual medical check. See, because uric acid problem is not very common, so we don't find it in the general population very commonly. Maybe a very small percentage.
Except people like us.
Yes, but those who have the tendency, it can be significant. So that's why when you are doing your annual medical, you do it once in a year. So at least you are able to pick it if it is there, and then you treat it.
When I hear it, yes. Those that have the tendency, my own 11 density.
Okay, so concerning the brisket bone, yes, I'm happy that you brought that correction, because when I was growing up, even through medical school, I used to hear of biscuit bone, and I could not find it anywhere in any of my textbooks. What is this biscuit bone that they are talking about? So it was in the course of my postgraduate training, not even medical school, that I realized that it is brisket bone that they corrupted to biscuit bone. Yes. So yes. So that brisket bone is those soft bones, like cartilaginous. It's actually cartilage. It's good for, as a source of nutrients, but it has little value in terms of what it does to your bone. Yes, you should rather drink milk, okay, which gives you calcium, than to be eating bone, because bone.
Any kind of milk.
Dairy product, cheese, meat, milk, they are all dairy products. Even whole grains, they are rich source of calcium. Yeah. Yes. Then, of course, like the vitamin D also would help to push in calcium into the blood.
Okay, sir. When you talked about...
sorry, I thought you still wanted to...
Yeah, like talking about milk.
Yes. Sorry, sir.
You see...
Talking about milk, for me, I don't do condensed milk. I do skimmed milk, because they tell us as a result of as you grow too, you go to cut down on some of those things. So most of the times now, like that's skimmed milk, because it come out the fat every. I don't know how.
No, that's fine.
If you do that one, you do breast milk. Milk, not the milk. Okay, after.
Thank you. So no, it's good. The skim milk is the fat that they take out, but the calcium is still there.
Okay.
Yes.
Mm-hmm.
So perhaps we will fit to do skim milk, whiskey milk,
you do that,
concentrated milk. No, you get condensed milk. Breast milk.
No, human milk is coming into the market now.
Yeah? From where? From where? How?
Mr. Onoja, professor of physiology.
but human milk is still the best. It contains all the micronutrients. Now, it's true, sir. Well, sir, he talked about some of the remedies for that you should take salmon, fish, and mackerel. And most of the thing he brought about has to do with the oil. When they say catfish, I'm just trying to say, because catfish also contain oil depending on the kind of feeds we use for them. There are some catfish that are very oily. So I'm coming.
Now, question you will ask. Because it start lecture now. Lecture where we know your fish instantly substantiate. You get your house, you get your fish pond. You are surviving in the place, you are training your children, and you are living in the house. Me could not appreciate that. If sabi something we concern fish, including mommy water. But anything medical, no listen to them yet.
The question is this: when we're growing in the village, our mothers normally put catfish and then like to smoke, and they say it's good because it helps to sustain the bone. So how do you relate that?
You mean the smoke?
Yeah. How do you relate that?
No, smoke is not smoking. Smoked fish has been linked to cancer of the stomach. Yes. Incidentally. Yes. So smoke. That smoke in itself is carcinogenous.
Sure.
It's carcinogenic. It has the tendency to trigger cancer if it is consumed regularly.
Now make they suspect our neighbor way. You say na carcinoba?
Carcinogenics.
Oh, carcinogen. I say carcinogenics.
So smoking of fish, you can grill fish, but smoking is discouraged because of the tendency for cancer. Yes.
Damn.
We can grill.
Talk.
Yes.
Okay, I just want to get that particular word. We can grill instead of smoking.
Yes, you know, smoke, you have to bring in hydrocarbon. You are burning wood, and then the smoke is changing the color of
the food. I don't hear. How then they take grill? Then you can not put fire like that.
You can put it in the oven.
Oh,
just heat.
Charcoal and charcoal.
No, you don't have to use charcoal.
But if you know fit get oyibo charcoal oven, see bottom where the charcoal dey. Put plate on top where the smoke no go dey comot. The heat go dey comot. You don't grill your
yes.
Mu ustazan dako.
Good morning, my honorable president. Good morning, Brekete family, Brekete crew, and Nigerians. In fact, I want to thank God because this program seems to have been arranged for me. I sent a text message to my ordinary president, but I don't know whether he saw it. I sent the same text to Gentle Giant. He replied to pray for me. Last Saturday, I woke up from sleep at around 2 a.m. I was feeling a lot of pain on my chest. I could not breathe well. It was at 2 a.m. I didn't know what to do. I just knelt down and prayed. Then I sent a text message to my son in Kefi. He's a medical doctor. I said, Paul, this is what I am feeling. I don't understand what is happening. He immediately sent a message to me that I should come to Kefi the following day, immediately, because he was suspecting what Dr. Chris just said. Clotting of blood that could sometimes just get disengaged, run to the lungs, and that is all about you. That morning, surprisingly, I could feel well, so I came here. As I was closing from here, my son called that I shouldn't forget what he said. I should come to Kefi immediately. So I went to Kefi and met him. This is the test result. So they said they were suspecting some problems in the nerves which could cause blood clotting. And suddenly something can get disengaged from somewhere, go to the lungs, and then that will be all about you. So they did the test. This is the result. I don't know, if not God, why did I come here with it? I would have left it at home. But I came with it. I was so surprised when the ordinary president said Dr. Chris was going to talk. And he was talking exactly on what the experience I had. So I want to thank the ordinary president. I have been saying it. You are God sent. Sometimes I come here, I see people make you become angry. Please be angry, but don't stop doing what God has called you to do. Finally, I want to beg my ordinary president for something. There is something you used to say, which I don't like hearing. And I believe that everyone here will support me. Please, don't always say you have a sickness when it is mentioned. We don't like to hear that. We don't want you to be sick. God bless you. God bless Brekete Family. God bless us.
Wato shi Mele Ahmed da mu ustazan da ko yayi wallahi zai mu nuna mishi wannan magana ta kai Saudiya. Hembelembe mu ustazan da ko wannan magana ta kai Saudiya. Yayi izgilanci barawon banza barawon wofi. macuci azzalimi. La ilaha illa anta subhanaka inni kuntu minaz zalimin. Yes.
Okay, good morning, sir. I'm coming back to the exercise you talked about. That means to help out, you can do both the aerobic and the anaerobic exercise.
Yes.
Okay.
Yes.
Okay.
The aerobic will help your circulation, your breathing and all that. And then the resistance exercise, that's what gives advantage to the muscles and the bone. Where you are lifting, okay, or like you are riding a bicycle.
Yes, sir.
Okay, or other forms of weight resistance exercise, like in the gym.
Okay,
yeah,
sir.
Even push-ups helps in the muscles. It's part of resistance exercise.
Okay, I'm asking this question because I dance a lot, and that is my own way of exercising.
Oh, beautiful.
Yes,
Dance
sir.
is a good exercise. It's beautiful.
She say Arabic, ba?
Aerobic.
No, yeah? Oh, aerobic. I hear Arabic. I say, wait till I with Arabic now. Now, for those of you now, we get knee injury. The knee they pain una. As una hear doctor talk today, from now till the end of this month, don't run. Just do am. You do. Tomorrow you increase your speed. Don't run. You fit try to run, you go fall. But by the time you use this 1 month to build the muscle, the leg go dey strong enough, we go fit carry you this time around to run. But for now, when you go. Sometimes you can even decide to go this way. 1, 2, 1. Here they move. 1, 2, 1. You understand? No shame. It gets some things where they worry me. You wait or say you want to exercise around area. People will not go allow you with greetings. Some go one gist with you. Waiting carry you come. Hey, Dr. Otabor, beg that injection na chloroquine, I've been na chloroquine. Allow me to finish. I don't know if you understand what I'm saying. And then if you no get space, as they talk say, you need something will go make you day stronger, make you build your muscles. The weight of your body can help you. If you go, don't know they here. But for example, you no need to do normal press up if you want start, if you want build muscle from here upwards. Even if na wall. No cheat yourself. Oh. Listen, no cheat yourself. Do half. No. You must feel it in your body. Like if you go like this, if you won't come up, you go fully. Your veins, your arteries, everything. Then you go again. Then you go. No cheat yourself. Say, you want to do fast. The slower, the more the impact. Are we together? And if now from here downwards you want build, you can do squatting. Now squatting, this squat they see, you must not go down completely at the beginning. You go for 1 week, maybe just 1, 2, 3, 4. If you like. And then if you want squat, you no go scatter your leg like this. No be agwagwa you be. You go do like say you curve your leg small. I don't know. Now.
So I use this one.
No, never. I don't know when you. Now watch me. I know they like this. I know you do like this. Do like say you curve your leg small. Even if you get K leg. Now you are going 1, 2, 3. You understand? From time to time, you can go. Make sure your ears, the same line with your shoulder, and not by curving your shoulder. So if you squat, they do like this. Now greeting you, they greet. But if you go 1, 2, 3, 4, 5. Not do too much. If you do 5 today, tomorrow do 5. The day after tomorrow, you do 6 or 7. Now so you go to increase and small. One day you go do 200. You no go feel them. But some people just because they want to impress women. Who? There's some gym instructors wicked. I know you can do it. Push it. Push it. Push it. You go like that for house. In the morning, wake up nice. It be like say, village people don't they? So any question again?
Hadiza.
Good morning, my ordinary president. Good morning, doctor. Thank you for coming. My own question be say, for the elderly people who come along the line, they get fracture for their leg. After treatment, waiting they fit take manage themselves so that the bones go fit in again. And another question where I get, for a while now, I used to feel pain within this side of my ribs. So sometimes the pains go come, it go. I don't know what is the cause. If there's any advice for me, sir.
Okay, thank you. For the elderly people, we will treat the fracture depending on the type of fracture. Sometimes you don't need to operate, just to put a cast and then tell them to use crutches for some time. That will just be okay. And most of the fractures will heal. But some you will need to fix, like the one in the spine, in the hips. You have to fix those ones, or around the shoulder, so that it can be encouraged to heal. Usually, once you fix the fractures, there's nothing extra to do. The body would always heal itself. What we're just doing is to help the fracture to be in the right position until the body heals itself. That's it. So the body will always heal itself.
Because you see, bone, sorry, sir. Yes. Bone owner, they see. If this hand break now, whether you do them, you no do them, he go still heal himself. Only say, he go bend. Yeah. Now they tell people, not be said to go to traditional healers. No good though. But out of 100, maybe not 3 sabi waiting that they do. 97. Now out of frustration, hunger, now it make them turn. You understand? When they set your bone, some of them, if you know shout, they know they thing know they sweet. But when you shout in the presence of your wife and children, you go see him. You go like not to be
yes. And there are some fractures. There are some fractures we call fracture of necessity. Those fractures must be fixed. Even if you spend 10 years with traditional bone setters, you are still coming back to us. It's just that you have lost time and it's now more complicated. Those ones, they cannot tell the difference, but we can see it immediately. So sometimes if I see patients, especially those days when I used to practice in Kano, you see patients, you tell them you need to fix, they will go to traditional bone setters. 1.5 years after, they are coming back, more complicated with, infection and all that. And you still have to fix it because it's called a fracture of necessity. So the second question is concerning the pain that you are having on your flank. It could be as a result of your posture. maybe the way you sit, depends. There are so many factors. Some people carry rucksack, in their computer and everything on their bag. So that thing weighs down on their spine and it can cause them back pain. It might just be that the chair you are sitting is either too low or too high. So there are many factors. For a young person like you, most of the causes of pain in someone like you would be postural. Yes, not necessarily degenerative like in the senior people. So also, if you may need to come for an assessment so that we can ask you one or two questions, we'll be able to track exactly where the pain is coming from.
Hello, good morning.
Good morning, my ordinary president, sir.
Yes, sir.
Well done, sir.
You did live on air.
I am calling to publicly appreciate Dr. Otabor.
What do you do?
Yes, sir. A woman came to our office to ask us to pro bono write a letter to Brekete Family complaining about a clinic in Guarimpa. The clinic, she had, bone replacement, whatever, there. This hip replacement surgery there. It was a complete mess, a complete nonsense they did for the woman after collecting her money. I think they collected about 3 million or so, or 4 million from the woman. And the woman, they promised the woman that the woman would be able to walk, to stand after 3 days. The woman couldn't stand after 7 days. The woman started complaining to the doctor, and the doctor was saying that she's forming a jabot too much. She should not disturb him. Said the doctor started talking to her like
anyhow.
Anyhow, this woman should be, I know vividly the woman should be over 60. Now, the woman was now told by somebody there that if you don't want to die here, you better move to Alliance Hospital.
From their same hospital? From inside the same hospital, somebody tell her.
Yes, I think one somebody that came to visit her also, or from the hospital, I cannot recollect quickly now. But they moved the woman to Alliance Hospital. Said when she got to Alliance Hospital, Dr. Otabor attended to her immediately. And they said, Madam, with this thing I'm seeing, the x-ray after your surgery, it was a complete mess. Even the implants that was used for her was not even a genuine, so to say, a genuine one. That Dr. Otabor wheeled her to the theater, and they had operation on her. This woman, by the special grace of God, after the 3rd day, she started moving her legs, started doing everything. And the doctor there that promised to come and visit her has not come. She collected her money; they have not paid. I think we have the complaints with the office in Brekete now.
Bring the woman to the studio on Monday.
I will bring the woman to the studio by the special grace of God, sir.
Thank you.
What I want to say is that I'm saying it wholeheartedly that God is really using Dr. Otabor. In fact, the woman was told in Alliance Hospital that our own case will be the 4th correction surgery they have done on patients coming from the same clinic in Guarimpa. Which means the man was asking the woman to leave the place that there are some other people waiting for surgery. They don't have much space to keep her here. That she should go out and get the physiotherapy that will be assisting her. Okay. But when they go to Alliance Hospital, Dr. Otabor said it is not even about getting physiotherapy. The thing was wrongly done in the first place.
Thank you.
That yes, I want to thank him, and God will continue to bless him. You can see one of the reasons why most of them are ganging up against him, because I want to believe he's doing wonderfully well. He's assisting people, supporting people. In fact,
and doing the right thing.
The woman couldn't. Yes, doing the right thing. The woman couldn't pay the fee charge, but the woman managed to pay part of it. And Dr. Bazo said you can come later and pay at your own convenience.
Oh, please, let's appreciate Dr. Otabor.
God will continue to strengthen him.
Thank you very much.
And God will shame all his enemies.
Amen.
I'm grateful.
They don't disgrace one out of office now. The DG Naptip, they don't pursue her. And you remember about 3 directors. If in fact you get one particular one where don't work for Villa before, where every DG will come, enter the DG, they tell her and say, I can strategize for you. I can do this. Now, that particular director now deceived this woman where she lose her seat. So, and that director don't take for napkin. This time around, he is going. The director, they go.
Or everybody that is planning against him, bad against him, God will shame all of them.
Amen. Thank you very much.
Continue to strengthen him.
Thank
Mr.
you, sir.
Dr. Otabor, we are grateful. I'm talking on behalf of that woman to thank you that God will continue to strengthen you, sir.
Amen. Thank you very much.
Thank you.
Yes, Graphics Avenue, you say good morning, doctor. Many thanks to our ordinary president. Sir, can we have this doctor's contact for us to reach him? Dr. Otabor, we know they like to give you a number. Everybody for studio, make we beg him.
Please, doctor. Please, Dr.
Please,
Otabor.
we need contact.
Honorable President, I thank you very much for the
Make una beg him. Una no dey beg. No, if you come out, please, please, sir. Doctor, please, in the name of God, please, for humanity's sake, for God's sake, sir.
I'm not here to sell my...
Oh.
Yes.
Not be somebody request for this one. Okay. Who get Alliance Hospital number?
I do.
Give me I go announce am.
Okay, sir.
Waiting for who? The mic is off. You change the mic for him. Off and first. This one they on?
It's on, sir. I think so. Yes.
Dr. Otabor.
Yes, sir.
Thank you very much. You don't need to give us something way. The Alliance Hospital number now 080 97 14 26 23. Thank God. Pamela, they go to the hospital, so she get the number. Again, the number now 080 97 14 26 23. The second number now 081 73 48 09 another 09. The number again for Alliance Hospital, not Dr. Otabor's number. And he no give us now. We force him. Now me they announce the number now. Because I know say you no go agree. The number again is 081 73 48 09 another 09. Make we appreciate Barrister Pamela. So my brothers, my sisters, if I look on a system time, don't they give us signal to do to signal, make we continue to the van, they go. Yes, anybody get question, make we open telephone line in case Nigerians get question to ask. The number to call, they go mix two numbers for inside. Hello, good morning.
Hello, sir.
Waiting be on name, where you the from? Give me the other mic, please.
My name is Adamon from Abuja.
Okay. Hold on, sir.
I want to thank you and appreciate you. I've been calling almost for 6-7 months now.
Yeah.
But I can't get you.
Adamu, how is Abaji?
Yeah, we're fine, sir.
Well done, sir.
Yes, sir.
Thank you.
God will keep our life for us. God will keep on protecting you for the good work you are doing. Thank you very much, sir. Just I want to appreciate you.
Yeah, thank you very much. I appreciate. Hello, good morning.
Hello.
Yeah, waiting be on name. Where you Devano from? Waiting be a contributor.
My name is Peter Ayuba. I'm calling you from Jabi.
Okay, how Jabi today, sir?
Fine, sir. Yeah, I get questions to ask. I want to ask you. And my mother, she fell down. I think it's 2001, and she come out that day. Rain fall in the morning. She come out and she fell down, and up to now her hand just paralyzed.
Doctor, you hear him? He say, "His mama just fall down, and up till now her hand." Is it only one hand? Be one hand and one leg. That's the way she take fall.
just one hand, and she fell down from that hand. The hand just paralyzed now.
Okay. How old is our mother?
She about almost 60-something years.
Okay. So, doctor, you don't hear? Yeah. What will be the answer, sir?
I would like to ask some more questions.
Okay. Doctor, I want to ask you a question.
Yes,
sir. Is it only the hand? Is the leg also involved?
The leg, they normal.
Sorry?
The leg, they normal. Now only the hand.
Yes, now only the hand.
Now only the hand.
Normal, now only the hand.
Okay, maybe she has a fracture.
And she always complaining about the hand, seriously.
Now fracture she get.
Most likely she has an injury that involves the bone. She should see an orthopedic surgeon.
Doctor say, may she see orthopedic doctor?
Yes, you can go to Gwagwalada Teaching Hospital.
Say, make you carry her go Gwagwalada Teaching Hospital.
Okay, sir. She is in Plateau. In
Abuja. What of University Teaching Hospital?
Yes, just University Teaching Hospital.
Jute. Carry her go Jute.
Okay.
Thank you, sir.
Thank you.
When imagine, doctor, they refer people to other hospitals. Let's appreciate this man a bit. Hello, good morning.
Hello, good morning, Honorary.
What be your name? Where you develop from, sir?
My name is Stephen. I call you from Medalema, sir.
Okay, what be your contributor?
I want to complain about I get heavy waist pain if I sit down for car come out. And I be want to complain about the operation. You get one day one time when they do my wife operation for Usi Hospital. From Karishi Hospital. Then say she get ulcer. Say the ulcer don't blow for her belly. We then take us to Usi General Hospital. We say we stay there for 2 weeks, then do scan, do other things before they do my wife operation. They do my wife operation, they later call me, enter inside the hall. Say they don't see any sickness for my wife, but and my wife they was pregnant that time.
Oh my goodness.
So I later lost my wife.
Oh!
During the operation, then do an operation, get baby. I said, how I do the operation now? When I see not, they come me enter the theater room, turn a room, say waiting then see. After scan from Karishi, then carry us to ambulance, come to State General Hospital. For 2 weeks, then they do scan, they do different scan, put us for different scan for 2 weeks. They still go on do the operation. Last time they say nothing, they see inside the belly. And I later lost my wife. Now leave me with 3 children. Now they suffer with 3 children.
Please, come to the studio on Monday, sir.
General.
Make you come to the studio on Monday. Come to Human Rights Radio and Television on Monday, sir.
Okay, sir.
Yes, sir. Thank you, sir. Sorry for your loss, sir. Shumen Farouk names you. He said, good morning, Ordinary President. I'm just joining your program today, and seriously, I'm enjoying your program. God bless Brekete Family. I am Farouk Shumen Nanzu from R.O. Kola, local government area of Taraba State. Make we appreciate them. Shumen Farouk names you. I will advise, make you subscribe, click the notification button, so that anytime we will go live, because we want to start some other programs on the same channel. Thank you very much. Make we take one last call, then when we come back come out for studio. Hello, good morning.
Good morning, sir.
Yes, sir.
Yes, sir.
What will be your name?
Sir, my name is Adimola Salaudin. My foot at the hillside of it, when I wake up in the morning, I will be able to match ground. Not until like 10-20 minutes. But when I pray finish, as in when I go more straight, I will get myself again the next morning.
But anytime when you sleep like this, wake up, your leg be like say no be your leg again.
Yes, sir.
Okay, thank you. Dr. Otabor down here. Make you listen to Dr. Otabor. He won't talk to you now.
Okay, sir. God bless you.
Okay, so he has what we call plantar fasciitis. It's inflammation of
now.
Inflammation of one of the layers of the foot. Yes, that's what causes it. there are a number of things that can be done for him. He needs to visit a hospital for treatment, including an injection. Many of the patients have treated like that with a steroid injection. Then it disappears.
Okay,
Yes.
Thank you very much.
Yeah.
Thank you. My brothers, my sisters, if I look at on a 60 time, don't they give us signal to do it in signal, make we pack come off for studio.